Hello all, today we can see about peritonitis. Peritonitis is a disorder of peritoneum. This is the moist tissue around the inside of the stomach wall. The condition usually occurs following a bacterial infection. What is peritoneum? The abdominal cavity containing the main parts of the gut such as stomach, intestine. It also contains other organs such as the liver and kidneys. The peritoneum lines the abdominal wall but also forms folds that go inward. By folding in the peritoneum waves between abdominal organs, providing a membrane that protects and stabilizes the organs in the abdomen. The folds of the peritoneum also contain blood and nerve supplies. These vessels can be seen running through the membrane that circulates the intestines. Causes. Infections cause most cases of peritonitis. In rare cases, these are infections of peritoneum itself, but infections from elsewhere in the body are a more common cause. A rupture in the gut is often a source of infection. Rupture comes from a burst appendix or a hole created by severe stomach ulcer. People on a type of kidney dialysis that involves exchanging peritoneal fluids can also become infected. Other possible causes include inflammation of the pancreas, inflammation of the gut by conditions such as Crohn's disease, diverticulitis, or inflammation of pouches in the large bowel wall. Injuries that cause abdominal trauma such as knife or gun wounds. Peritonitis can happen to people who have excess fluid in their abdomen because of long-standing disease, especially liver disease. This is one of the less common cause. While uncommon, the peritoneum can also be affected by cancer. What are the two main types of peritonitis? The two main types of peritonitis are primary spontaneous peritonitis, an infection that develops in the peritoneum, and secondary peritonitis, which usually develops when an injury or infection in the abdominal cavity allows infectious organisms into peritoneum. Both types of peritoneums are life-threatening. Symptoms of peritonitis. Symptoms will vary depending on the underlying causes of your infection. Common symptoms of peritonitis include tenderness in your abdomen, pain in abdomen that gets more intense with motion or touch, abdominal bloating or distension, nausea and vomiting, diarrhea, constipation or irritability to pass gas, minimal urine output, anorexia or loss of appetite, excessive thirst, fatigue, fever and chills. If under peritoneal dialysis fluid may appear cloudy or have white flakes or clumps in it. We may also notice redness or feel pain around the catheter. Diagnosis of peritonitis. If we have symptoms of peritonitis, delayed treatment could put life on risk. So first we can ask the medical history and perform complete physical examination. This will include touching or pressing on abdomen, which will probably cause some discomfort. Several other tests can help doctors to diagnose peritonitis, like a blood test called a complete blood count can measure white blood cells, and high WBC count usually signals inflammation or infection. A blood culture can help to identify the bacteria causing the infection or inflammation. Then fluid analysis. Next, imaging tests like CT and X-ray. Next, treatment. Peritonitis is considered as an emergency treatment is normally carried out in hospital. Treatment options will be include antibiotic medications, surgery, a hole in the gut, and operation may be also needed. Remove damaged peritoneal tissues, wider support therapies. These therapies can range from intensive life support to dietary assistance. Thank you.